Minnesota Senator Amy Klobuchar has revealed that she battled breast cancer early this year. And earlier on Good Morning America, Klobuchar spoke exclusively to Robin Roberts about her health and why she's now urging women to get screened. Let's listen.
What is it that you would like to share with us right now?
Well, thank you. Thanks, Robin. And that is that earlier this year, I found out I had breast cancer, routine mammogram, something I'd put off during the pandemic, like so many others. And I found out that I had cancer, and it was stage 1, and they were able to remove it. I had radiation in May, and now they tell me that my chances of getting cancer again are the same as any average person, which is great. But I learned a lot through this year, as I know you know, about the importance of getting those exams and also the gratitude for all those that surrounded me and my family, my husband. It's something that no one wants to hear and no one wants to experience, but it's really renewed my faith in the people around me and in my purpose.
And your purpose, and it's nothing that anybody can ever understand when you hear those words that you have cancer. And so you look great. How are you feeling these days?
I'm feeling much better. You know, for me, I had to be juggling a lot, just like a lot of Americans right now who's got their toddlers on their knees and their laptops on their desks and their health, their job, their family. But for me, I had a bunch of hearings that I was chairing. We had the big America Rescue Plan we got through. I had radiation 2 days after my dad died, and I thought, you know, his was a long goodbye. He had Alzheimer's, and so that was going on at the same time. And it really, my husband taking me to radiation, these are my memories. I'm sure you have yours when you were battling this, but my husband getting up early, taking me to radiation, my daughter's phone calls, the nurses at the Mayo Clinic giving me a red, white, and blue mask when I got done with radiation, the perfect strangers, because I had to keep lugging my suitcase back and forth between Minneapolis and Washington, who would, not knowing I had cancer, you know, we're all wearing masks, not knowing who I was, would be like, can I put that suitcase up for you? Because you're not supposed to lift things after surgery. So it's just a lot of people helped me get through this, and I learned every day is a gift.
It is a gift, and it just, as you said, about purpose and just an understanding of why something is placed in your path and what you're supposed to learn and share, which you're doing right now. And as you admitted, like so many during the pandemic, put off a screening. This is part of the reason why, because you did that, and it's part of the reason why that you wanted to share with people. And what is your advice to folks?
You know, right now, thousands of women have undetected breast cancer. 1 in 3 Americans have put off going to any kind of routine examination or procedure. And so doctors over and over are telling me that they're seeing people with much bigger problems than if they'd gone in early. So that's my first practical advice. Get those screenings, go in, get a mammogram, get whatever health checkup that you should normally be getting, because we know there's so many better safety controls now in doctors' offices than at the beginning of this pandemic. And the second is, you know, just be grateful for the people around you. Yeah. It really puts things in perspective.
Our thanks to Senator Klobuchar and Robin for that interview. And for more, I'd like to bring in OBGYN and ABC News Chief Medical Correspondent Dr. Jennifer ASHTON for more on this. Dr. Jen, always great to talk to you, especially about things like this that hit so close to home. What stood out to you from Senator Klobuchar's story?
Well, so much, Diane. First of all, like so many women, and we've been reporting on this here at ABC News from pretty early on in the pandemic, cancer screenings, routine and potentially life-saving cancer screenings, have been put on the back burner during this pandemic. Now, initially, for some historical perspective, that was because that was the edict, actually, that all non-emergent, non-COVID-related routine screenings, you know, be put on hold. But then when things started opening up over a year ago in terms of our routine medical care, people were still afraid. They were still concerned, and so they put it off. I heard it from countless number of women in my practice, and this is a perfect example. And if it can happen to a senator, it can truly happen to anyone. The other thing that I think really stood out is Senator Klobuchar said her breast cancer was detected by routine screening mammogram. That is because in the world world of radiology, the idea behind a mammogram is that it can detect a mass, a malignancy, approximately 2 years before it grows to the size where it could be palpated or felt by the woman or her healthcare provider. Not every cancer can be picked up on mammogram. In particular, with women who have dense breasts, they may find their cancer on ultrasound or sonogram. So a lot of times women are directed to get both. But this is just an example that with not just with breast cancer, but with a lot of types of cancers, the earlier we catch it, in most cases, the better the treatment can be, and therefore the better the outcomes can be.
And as we heard Senator Klobuchar say, many cancer diagnoses went undetected during the pandemic because a lot of people skipped their appointments. They stayed home. Now, according to JAMA Oncology, approximately 3.9 million breast cancer diagnoses in the U.S. may have been missed in just the early months of the pandemic alone. So what's the importance of these mammogram screenings when it comes to early detection, and how important is that early detection?
Well, it's important for breast cancer, and we have to remember that we also have routine cancer screening for colorectal cancer, so the numbers are potentially as concerning with respect to that type of cancer. But with respect to mammogram, we hear so much controversy about the age, about its ability to save lives. You know, it's an imaging test, so it has its limitations. It's not perfect, but right now it is the gold standard. So when you talk about catching cancers early, that obviously is the name of the game in oncology, and that's what we try to do with a screening test. But Diane, I'm dealing with so many women who I have to be the doctor to make that call and say, your biopsy was positive, it showed you have cancer. And no one wants to hear that. And we have to remember, by the way, men get breast cancer, too. It looks like a pink disease, but there are almost 1,000 cases of male breast cancer in the country every year. They don't have screening, obviously. But the key, even though it feels like an emergency to go and rush and see a breast surgeon, is that you have a moment, take some time, take a deep breath. If possible, get a second opinion if you're talking about reconstruction or more extensive surgery. But this is something that, you know, when you hear a senator come forward and talk about her experience, I think it really does a lot to help destigmatize and encourage people to go and get that screening.
Certainly a good reminder to make those appointments. Are there any other preventative measures that people can take to try to decrease their risk?
Well, yeah, there is a lot, actually, that we can do as women to lower our risk. Number one, there have been extensive studies in the medical literature that show that exercise, in particular, things just like walking or basic cardio, done at any time in a woman's life, even when they're young, as a teen or 20s, can lower risk. Reducing alcohol consumption below 7 servings per week, that is a clear risk factor for breast cancer. We don't want to hear that as women, but that is something that we can all do. And then breastfeeding, believe it or not, has been shown to be associated with a lower risk of breast cancer. When you talk about other things, Diane, like hormones, birth control pills, or hormone replacement therapy, that's a much more complicated decision that ideally should be had between a woman and her gynecologist or healthcare provider. But just those 3 things are something that we can all do. And more importantly, Diane, and something we don't hear about, the daughters of women with breast cancer can do those things and help lower their risk and address some of their anxiety about the future as well.
Now, on the alcohol thing, can you save all those drinks during the week and then drink them all on the weekend?
No, you can't, just like sleep. But, you know, just to that point quickly, Diane, you know, I deal with a lot of women who are so concerned with hormones and breast cancer risk. The risk with hormone replacement therapy, for example, is 1 additional death from breast cancer per every 10,000 women. So it's a slight risk, but no woman wants to hear abstain from alcohol completely. That will lower your risk more. And it's something that, you know, we all have to dodge this bullet. We all have to make these decisions for ourselves. Obviously, your individual family risk factors come into play. But it is important that there are things we can do to help lower our risk.
It was worth a shot, Dr. J. Always great to have you. Thanks, Dr. Ashton. Such an important topic.
Thanks, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.